What is meconium ileus in newborns? Imagine a tiny baby's first few days after birth, when they usually pass their first stool called meconium. In some cases, this first stool is much thicker and stickier than normal, which can cause a blockage in the last part of the small intestine, known as the ileum. This condition is called meconium ileus. Normally, babies pass meconium within the first 24 to 48 hours after birth, but if the meconium is too thick, it can't move through the intestine properly. This can lead to symptoms like vomiting, swelling in the belly, and not passing stool. Sometimes, the baby's abdomen becomes enlarged, and they might have trouble breathing because of the distended belly pressing on their lungs. Meconium ileus is most often an early sign of cystic fibrosis, a genetic disorder that affects how the body produces and manages mucus and secretions. In cystic fibrosis, the body's secretions become unusually thick and sticky, especially in the lungs and digestive system. This thick mucus can block the intestines, leading to meconium ileus. In fact, about 10 to 20% of infants with cystic fibrosis show signs of meconium ileus at birth. Conversely, around 80 to 90% of babies with meconium ileus have cystic fibrosis. The thickened meconium sticks to the lining of the intestines, causing the blockage in the ileum. Doctors can sometimes suspect meconium ileus before the baby is born by using ultrasound scans to look for signs of bowel obstruction. After birth, diagnosis is based on observing symptoms like failure to pass stool, vomiting, and abdominal swelling. Imaging tests such as abdominal X-rays can show dilated loops of small intestine and sometimes a narrow colon called a microcolon, which happens because the colon isn't used much due to the blockage. In some cases, contrast enemas are used both to diagnose and treat the problem by helping to loosen the blockage. Treatment usually starts with enemas to help clear the thick meconium from the intestine. If enemas do not work, surgery may be needed to remove or bypass the blockage. Since meconium ileus is closely linked to cystic fibrosis, infants diagnosed with this condition are often tested for cystic fibrosis through sweat tests and newborn screening programs. Early diagnosis and treatment are very important because they can help prevent complications, improve the baby's comfort, and guide long-term care for cystic fibrosis. Understanding this condition helps caregivers and healthcare providers act quickly to ensure the best outcomes for these newborns. Always remember, if you notice any signs of bowel obstruction in a newborn, seeking prompt medical advice is essential for proper care and management.